I looked at that joint before and after, and in terms of what it looked like, and it looked like a dog was chewing on the bone. That's how toxic this stuff is. Like if you inject these into joints, the other orthopedic doctor eventually was like, "Okay, you're not getting it better. Maybe we just need to chop off the bone, the collarbone." Because it's not like you need that bone. Just chop it off and throw it away, and hopefully the rest of the shoulder gets better because it's not.
Welcome to the Fountain of Vitality podcast. I'm your host, LaMont Leavitt. In a world overflowing with noise, confusion, and distraction, we're here to cut through the clutter and explore bold, unique paths to a longer, healthier, and more vibrant life. Through candid conversations with business leaders, wellness experts, industry pioneers, and innovators, we'll uncover insights to help you discover your own personalized, unique approach to thriving. Tune in, trust the compass of wisdom within, and find your fountain of vitality. Hello, my name is LaMont Leavitt, and welcome to the Fountain of Vitality podcast. We're excited to have with us today Dr. Fawad Mian. He is the founder of Ascend Regenerative and has had quite a list of things he's done in his life that take us down some interesting paths. Doctor, thanks for joining us today.
Thanks for having me on the show. We're looking forward to this.
Looking forward to hearing how you got into regenerative medicine, how that worked for you, and how you're helping others and your patients.
Yeah, so it's kind of one of the things you kind of stumble into, really, honestly, and just kind of give you like the maybe shorter synopsis of what happened. But I'm a board certified neurologist, and I've been practicing since 2009 at this point. I guess 16, 17 years or whatever it is at this point. And so one of the things that happened one day when I was lifting weights, because I enjoy being physically active and lifting and doing those kinds of things, is I kind of had an injury that developed after one of the weights slipped in my hand. I was doing something called shoulder shrugs, and I'd injured like the small joint called the AC joint in the front of the shoulder. It was really excruciating. I had a hard time sleeping on it. I had a hard time, putting my arm above my head or putting a jacket on and a shirt on because it was just so painful in certain positions. And,
Yeah.
it was miserable. I was just popping like anti-inflammatories or day in, day out for like a good month or so before I saw the orthopedic doctor, because that's what you do when your shoulder hurts, right? And so I went to the orthopedic doctor, and one of the first things he told me was like, you know what, maybe we can get a surgery out of you. Maybe you have something called a slap tear. In English, what that means is just torn cartilage kind of on top and in the front of your shoulder here. And fortunately, I did not have that after an MRI, but I did have a lot of arthritis in that small joint that I mentioned that got injured. And, so the physician assistant just injected some steroids into the joint blindly twice. It didn't really help so much, maybe 10% better at best. I was still pretty miserable, still couldn't do anything. At the same time, I would see a lot of patients come into my office who were sent by other orthopedic doctors and pain doctors who said, your problem is neurological. And they're coming in with all sorts of neck issues, shoulder issues, and knee issues and everything. And then so I was kind of puzzled at the time, kind of scratching my head. While all of this was going on, as one day I was getting ready to go to work, and I'd put some shoes on that I only gotten a couple of days ago, and I was walking in them, and my foot really started to hurt. I just give you a little background. I did training in New York City, so I walked a lot in dress shoes for at least 2 years. Best shape of my life, honestly, being around in that time. But this was miserable, and I thought, hey, must be really bad shoes that I got. So I took them off, put on some other shoes, didn't feel much better. Same kind of thing, took anti-inflammatories, elevated it, iced it, rested, did all the things that everybody tells you to do or Google tells you to do. And then I went to the foot doctor because that's what you do next, right? When it just keeps
Right.
I went to the foot doctor, kind of took a look at everything, did some x-rays, gave me some orthotics, which I thought would help, even though I thought they were on the pricey side. They actually made things worse. But he said you have something called plantar fasciitis. And so what that means is that's like inflamed tissue on the bottom of the foot. And, he said, you know what, try the orthotics. There's some exercises you can do. There was some low-level light laser treatments that he made me do, and it didn't really help so much. And I was pretty miserable. I was wearing, at one point I was wearing what I thought were kind of Frankenstein shoes, really thick soles.
Oh, yeah. I've seen those.
But now they're in fashion, right? They weren't in fashion back then. They look weird. But back then, I got a pair of like was it Hoka sneakers, and Hoka sneakers. I don't know how long they had been around at that point, but you never saw anybody wear those things. Now they're everywhere, and the sole, another thing much thinner in terms of the padding. But so I had those things, and I had some other orthotic looking shoes too as well. I was miserable walking around in them. I went back to the foot doctor. He gave me some steroid injections. After the first round, not much improvement. After the second round, a little bit more improvement. By the third round, I felt 50% better, and I was like, you know what? Hey, steroids work. Third time is the charm with this one. So I went back and I wanted to go back to the gym because I enjoy being being physical and being fit and exercising. And so I ran on the treadmill. Within about 15 minutes, the back of my heel, or the Achilles, was really, really hurting. The inside of my ankle was also really hurting. And so I developed what we call like Achilles tendinosis, which is kind of when the tendon starts breaking down over
Oh,
time.
that sounds awful.
Yeah. And so I went back to the foot doctor, and he, did some other treatments for it, did some shockwave treatments, which are helpful. I mean, it's something we do in the office too as well, but it wasn't getting me better. Doing some low level light laser treatments, not getting any better. And so while all of this was going on, and I'll tie it all together here in just like another minute or whatnot, my left knee started hurting because now I was changing the way that I was walking. So all these injuries starts changing how you move. That's critically important. Just to give you background on my left knee, I had an ACL repair theoretically back in 2001, after playing some sports when I was in med school. And so it was really bugging me. And, I went to a different orthopedic doctor after I sat in his waiting room for a good 2 hours, did some x-rays. The guy barely took a look at me, tugged on my knee and said that I should get my knee scoped. And I was like, wouldn't we want to do like a little imaging first to like take a look at everything? And so I had like one of my colleagues just get an MRI, and then, lo and behold, the ACL that was theoretically repaired back then wasn't really repaired. It actually was torn. And so now I'm speaking with colleagues now who are kind of in the same space of what I do, the orthopedic surgeons. They're like, yeah, they didn't put it in right. Because
Oh, no.
that's not really supposed to be happening or whatnot. But even some other ones, all different doctors, all the same opinion. They're like, that was not put in right. It shouldn't be that easy. Or if it was put in, it wasn't put in well enough where it wasn't going to tear. So all I have is a bunch of scar tissue to really with that, and my knee was hurting. So between my shoulder, my foot, and my ankle, and my knee, and I wasn't 40 yet at this point.
You're breaking down.
I'm breaking down, and this was early for me because I talked to other docs and other people or not. It's like, oh, wait till you're about 50 or in your 40s, then it really starts happening. I'm like, I'm not even there yet. I'm still in my late 30s. This is miserable. I'm like, good God, I can't imagine how I'd be like if I was like this, and then I was much later in life with all this.
Yeah.
And so I felt stuck with all this because I went back to, one doctor wants to scope my knee without doing an imaging. The other orthopedic doctor eventually was like, okay, you're not getting it better. Maybe we just need to chop off the bone, the collarbone, because it's not like you need that bone. Just chop it off and throw it away. And hopefully the rest of the shoulder gets better because it's not fixed. Like, at this point in my life, after having gone through, multiple surgeries for different things, I want to keep what I came into this
What
world
you're
with.
born with. Yeah.
Yeah. And so I wanted to keep that part of my shoulder. I didn't want to chop it off and cause more issues later on. So obviously I didn't go back with that. I felt frustrated with it. I was still popping anti-inflammatories, not feeling much better. And obviously that does a number on your body, which we can talk about later. But then I went back to the foot doctor. He's like, you're not getting much better. Maybe what we need to do is we need to shave the bone down. So it's not just shaving the bone down. It's detaching the tendon, shaving the bone down, reattaching it with anchors, being in a boot, and being in a rehab for a while. It's not like it's a small procedure that's being done.
No.
It's a big procedure. And so it's not as, so he was a little nonchalant about that. And I was like, okay, I'm stuck. All these doctors just want to poke me with things, chop out things and all of this. I've already had surgery, like surgeries on my jaw, my knee, it's already failed. Tired of the anti-inflammatories, other pain medications would actually impair my ability to do work. Seeing patients in my office who are sent for neurological issues, as I was learning, they're more musculoskeletal issues that were masquerading as presumable neurological issues, so to speak.
Interesting.
And so I kind of was at a loss, and this was like 2011, 2012. And it's not like we didn't have the internet and things like that. It still obviously existed and it was robust, but the amount of resources there are now compared to they were back then, And what you could find, it's exponential now, right? You see things everywhere. Back then, it was hard. I was really digging and searching and looking online, calling this and that or what. And eventually, I stumbled on something called prolotherapy. And prolotherapy basically is an injection-based treatment that basically involves injecting like a sugar-based solution to create some inflammation and to help the healing environment. And so I went out for some training to learn more about this out in Colorado. I mean, closer to your neck of the woods. And, had some treatment. It started helping. I started learning about PRP or platelet-rich plasma and adopted that the following year, like in my office. I had a few treatments for my plantar fascia, took care of it. Remember, I had to undo 3 steroid treatments too as well. Steroids ultimately destroy and damage everything, and they're toxic to bone, they're toxic to cartilage, and they break down tendons too. For my AC joint, I had to self-treat with PRP several times to help repair the ligaments. Just to give you an idea of what steroids do after they had been done in here. Granted, I had arthritis in this joint, but when I put an ultrasound probe before and after, you could actually see like a big difference in terms of how the joint looked at when they actually injected the steroids.
So you can see a difference physically if
You
you
can
look
see
at
a physical difference. And the thing is, if you get injected with steroids, you don't see that, right? You don't see what's happening in your body. Here I
Yeah.
did. To prove it to myself again, I had like a little synovitis in my hand, which was in the wrist because I have autoimmune issues. And I had actually injected it myself in my wrist. And, it was in a small, tiny space that was injected. There was a lot of fluid and inflammation there. It got rid of it because that's what it's supposed to do. With that inflammatory reaction that was going on from the autoimmune process. But same thing happened. I looked at that joint before and after, and in terms of what it looked like, and it looked like a dog was chewing on the bone. That's how toxic this stuff is, like if you inject these into joints. And so that's why we try to avoid doing things like that. But nevertheless, I was able to fix my shoulder by doing things like PRP, and I did a few rounds of Prolo too as well. I was able to fix my ankle and my joint the same way. The Achilles got better with several rounds of PRP because it was really, really bad. I'm not going to win any Achilles of the Year award or anything like that with the way that it looks, but I'm at the point where I can run again without any issue. I don't have to wear any crazy looking shoes or expensive orthotics or anything like that.
So PRP worked well for you then.
It worked really well. And then even with my knee, granted, I don't have an ACL, but I tried to help strengthen some of the structures that were around it. I had my MCL, which is one of the ligaments on the inside of the knee, actually was never addressed. And I found that there was some tearing there near the cartilage. And so I had to inject that along with other areas to help strengthen the knee. It doesn't mean that I don't have increased arthritis from after having had the surgery or whatnot, but it's in much better shape than where it was before. And so I had implemented these things over the years with my patients too and getting good results. And so when patients were coming in with presumed, this is neurological, it's just chronic musculoskeletal issues. And as we're able to fix those things with patients, just doing regenerative treatments and other holistic approaches, we found that, we're doing a better service for the folks that we were serving ultimately too as well. And we found that, this was a great alternative way to really helping people without having to rely on things like drugs or surgery to actually get better.
That's great. Autoimmune diseases are interesting, fascinating. A lot of people struggle with those. Do you think if someone has an autoimmune disease, it increases the likelihood they'll have these kind of challenges, or they're not connected in your mind?
For people who have things like, because autoimmune is like a large bucket of things, people who have autoimmune issues can have things like arthritis too as well, and just constant inflammation. And so being able to try to address that where we're doing lifestyle changes, we look more on the functional medicine side to see what drivers there are to this to help dampen it down because autoimmune diseases are not really curable or anything like that. You have them, and the more you start digging from, the more you're going to start seeing it. And I see that even from functional medicine docs who send their patients over here, and they did this long laundry list of things. It's confusing for them because they have all these autoimmune markers or whatnot.
Yeah.
And so you can imagine if you did on everybody, it'd be very confusing or whatnot. But being able to better treat that condition from a holistic approach certainly helps. And in the right people, I found that regenerative medicine certainly helps. I mean, for me, it doesn't cause more of an inflammatory issue that happens. For people, rheumatoid arthritis, sometimes it can set people off too as well, and sometimes not. So I've kind of had it go both ways. But, whenever we're doing injections, one of the things I do want to say, it's not just doing the injection itself and then have a nice day and that's kind of the end of it kind of thing, because you have to improve the functional movement of what's happening too as well, so you don't get back into the same kind of mess or you really mitigate that. But then in order to heal, it's also important with the healing environment inside the body too as well. How much inflammation is going inside of the body or whatnot. What's your diet like? What's your mindset like? What's your exercise level like? How are you sleeping? How's your gut? There's a million different, your hormones. There's a million different ways to go about doing that.
Yeah. Okay. Wow. Fascinating. With is there any as long as we're on PRPs, is
Hmm.
there any conditions or as people come in that they
Hmm.
should ever do a PRP, or is it pretty much everyone should give it a shot in your mind?
Well, it depends. So, I wouldn't say anybody who walks in the door gets PRP or stem cells because I turn a lot of people away too as well, or I find that it's not the right fit for them. Uh,
Hmm.
Look, if somebody's coming in and we evaluate them, we find that there are no major issues contraindicating the treatment with this, and if the people are willing to, work on themselves, and tell them, look, this is something that we can do where you're going to get a better outcome. There may be cases where your condition is so far gone where we're able to make you functionally better, not 100% or anything, but maybe we get you a 50, 60, 70% better. It may make a huge difference in your quality of life. And so we kind of review that with them too as well. But there's a lot of potential for people to get it done, so long as they keep open-minded about it, and obviously they're properly evaluated to make sure, this is really the right treatment for them, and that there isn't something else, or that they really don't need surgery at that point. So I wouldn't say every person, but that a lot of people will qualify more so than you think.
Okay. So with regenerative medicine, besides PRPs, let's talk a little bit about stem cells and some other things you've used that have been effective.
Yeah. So autologous stem cell therapy. So we're talking about stem cells that come from you, mesenchymal
Hmm.
stem cells. We're talking about like on bone marrow, and then there's also fat too as well. They all contain called these pluripotent cells to help with um, mitigating the inflammatory response, also with trying to differentiate to a certain extent in terms of making the tissue and the cartilage better. And we see that radiographically in patients too as well, where there's an improvement in that. And obviously there's ongoing research with that too as well. But we also find that really effective. And so we see it more so effective for things that are tend to be more on the severe side. So, people who have bad tendon issues, people have bad osteoarthritis too as well. A lot of times we'll use PRP to augment the stem cells depending on what we're injecting, because when we look at how we're treating somebody, we try to treat, the primarily the whole area, not just the areas of damage. There could be areas of damage in multiple other places that get missed. And so it's kind of like putting everything together so that it heals the best that it possibly can. And so stem cells is certainly one of those tools. What I do want to differentiate this from is actually the stem cells that come in bottles, right? Those are the umbilical ones, and they're rampant and they're everywhere and whatnot. It was looked at where those kinds of bottles didn't really have any actual viable stem cells. It was just dead tissue, maybe some growth factors
Mm.
of some sort that were in there that were actually helpful to a certain extent, but not actual stem cells. And obviously, people can also get reactions to those things too as well. And so you kind of have to be careful and diligent about what's being used. And in the US, it's kind of iffy. Some states have kind of opened up more in terms of stem cell therapies, which has turned it a little bit more into the wild, wild west. And so we got to be really careful with that. So we're basically in our office, we use what you came in with, right? And so we try to augment that in terms of your healing. And again, we'll integrate that along with like functional movement, also a little bit of functional medicine, try to really help the healing response and all that. But we found some great success in people who were told they ultimately needed surgery.
That's great. I'm of the opinion do what you can to take care of what you've already got,
Yeah.
and figure out. Sometimes that there's simple solutions
Hmm.
that just aren't covered in medical school because
Yeah.
that's not been the function of what
Yeah.
those are. So, love to hear a little bit more about some of the new things you're doing, as well, and what you have coming down the pike. If you'd like to share with us.
Yeah, sure. So, one, we, as a neurologist, we also work on other things too as well. So I kind of look at the whole body, honestly, when people come in to figure out problems. But one of the things that that I have been working on, which is actually not regenerative medicine in and of itself, is actually working on cognitive health. And so, just to give you a little background, the amount of people that come in who say, "I can't remember things," from ages as young as to like 18 to people who are in their typical ages between 40 and 60 have a lot of cognitive issues. And it's not necessarily just, people who have florid Alzheimer's or anything like that. There's so many different things that need to be addressed for somebody. And that's kind of why I kind of developed this course called Reclaim Your Mind. And so the idea behind that is to start having a better conversation with a doctor. Well, what kinds of things should I be looking for? What kinds of things should I be addressing or whatnot? Because at the end of the day, just like with regenerative medicine, we're trying to be as proactive as possible in preventing doing things that are not necessary, or, in this case, cognitively, going to medications which may not work very well. And even then, there are new medications out on the market for Alzheimer's, for more mild Alzheimer's, and it's a little bit of a tough sell for people, even though it's shown to be able to clear some of like the abnormal proteins that are kind of building up, because some of the side effects can be brain swelling and bleeding. And so when I tell people those are potential side effects, it's not like they said, okay, yeah, let's do it. So it's not something really prescribed. The other medications that are out there now, I think, are kind of like a coin toss in terms of being able to help people. And so when I look at anyone, we always look at, well, what kinds of things on the periphery can we take care of lifestyle wise, whether that's sleep, their diet, their nutrition, their metabolic system or whatnot. How can we get these things better so that ultimately you don't go down to the road where, you're developing florid Alzheimer's later on. And so that's something that I don't really see out there, being proactive, because you're always saying things about how can I improve my memory? And there's a million apps and a million different courses and speakers with that, but I don't see a lot about people who are being proactive about it. So a lot of cases of dementia can be prevented, so long as they're addressing multiple different factors. And I can just say, I'm just putting out just a few of them, not all of them by any stretch of the imagination, but things like sleep, for instance, are really important, right? Because with sleep, we're kind of our system is kind of flushing out toxins and proteins, many of which actually could cause things like Alzheimer's too as well. It's also allowing us to have consolidation of sleep too as well. There's also a symphony of hormones that start getting released during sleep. And so it's very restorative, right? And so if we are poorly sleeping and we're not making that a priority in our life, we end up with more issues later on. I see it all the time. It's not even just in the people who come in who are a little bit older. I see it like in, professional people coming in and they're like, yeah, I'm burning the midnight oil. I'm not
You're
getting
maxed out. Yeah.
maxed out. It's, even that a long time ago, maybe like 10 years ago, I would see this couple come in and I don't think they quite understood the value of their sleep because they had their kid come in with them too as well. And that kid obviously was maybe colicky, not sleeping very well. And the other guy, the husband is like an attorney. He's like, yeah, I can't really think straight. I feel constantly irritable and all of that. And it's kind of hard to get my work done. And I'm like, well, I mean, have you guys done any sleep training with the child? Have you done this? Have you done that? And they really hadn't thought about it, like how important that was until finally it just hit them in the face that they're not sleeping, but that a lot of people don't even recognize that they actually have an issue with their sleep. And they keep going and going and wondering why they feel tired, exhausted. They can't think of things. They've gained weight and they can't seem to lose the weight, all of that, or their blood sugar is going up, their blood pressure is going up. And so it's all intimately tied. So that's just one of many different things that we kind of try to review. And so I want to make sure that, people realize that this is something that's important to talk to with your doctor.
Yeah. Just curious. So you're seeing more of these kind of problems nowadays than you did, say, 10, 20 years ago.
Mm-hmm.
What are some contributing factors you think may be leading to that? I know obviously with stress and needing more sleep, but any other factors in your mind you think might be contributing to an increase in cognitive challenges?
Yeah, well, I mean, sleep, as I mentioned, for sure, because that's really important. You mentioned stress for sure, because elevated cortisol levels actually affect the hippocampus, which are the areas of our brain which actually allow us to help consolidate some memory too as well. It disrupts a whole symphony of hormones in your bodies. It's a whole topic of conversation for another day or whatnot, but it can lead to a lot of cognitive issues in people who are chronically stressed, amongst daily things it does to your body. But the other thing, that's I would think, would be obvious, but sometimes gets glossed over a lot is actually exercise. Um, Lack of exercise, I feel like it's more so now than it ever was before because of technology, right? So we're constantly glued to our phones. Everything runs 24/7.
We're more sedentary. We really
We're
are.
more sedentary. We're not moving. You're at least in a place where people are more proactive in terms of getting out there, and the weather's a little bit better in the Northeast. People may not necessarily be doing that. They may be avoiding it. And so, lack of exercise certainly can lead to greater issues in terms of cognition. One thing that we do know is that with exercise, it increases blood flow to the brain. Blood flow to the brain is actually helpful for neuronal growth. So actually, they researched it where the cortex was thicker in people who exercised versus people who didn't.
Interesting.
So you would want to, it's kind of like one of those things to me that's a no-brainer to do. But for some people who are not used to exercising or whatnot, it's kind of coaching them through like, okay, well, I mean, today, why don't we just try putting our shoes and our workout pants on? So at least you get into the mindset and the habit that I'm going to do something. And
Yeah.
maybe the next day it's actually, actually going outside for maybe 5 minutes and walking.
Walk
Like,
around the block. Yeah.
yeah, it's like baby steps. And then eventually down the line, it's incorporating some weights and things like that. But it's you kind of meet the person where they are. But that's, I think, really, really important. And so, those three things are certainly really important. There's a million other things from, blood sugar, insulin resistance to blood pressure, which are also really important. And so all these things kind of really need to be addressed, amongst other things too, as well, to get us to where we need to be cognitively.
That's great. Well, some of your newer things that you're working on too, if you
Yeah.
wouldn't mind sharing some of where you want to go with software and how you see making a difference there.
Yeah. So in the software, we kind of haven't quite put it out just yet. There is a software that we're trying to put out, and it's more relies on the sense of like for folks who are doing regenerative medicine and functional medicine and whatnot, but it's kind of on the educational piece of putting things together. And so the idea behind that is really getting the information out to people, where it's kind of simplified. It's easier for the practitioner to utilize too as well, to get that information out without going through cumbersome systems. And so that's something we look to roll out some point later in the year once it's all finished and developed and all of that. But it's something I'm excited about because I always look at what kind of problems do I have in terms of being able to put things out there for people. And so this is one of the things that I thought of and hoping it's going to be something that's going to be helpful for practitioners out there eventually.
Oh, that's great. That's great. Anything else you'd like to share with as far as how to contact you? If any of our listeners have functional or regenerative type questions, how can they reach out to you?
Well, there's a couple of different ways that if you go to prolohealing.com or Advocare Neuro Wellness MD, those are two sites that we have people go to for further questions and appointments. I wanted to also just share just for the course, there's a quiz people can take to see to help give them a better sense of whether or not they have a cognitive issue or not, or if it needs to be addressed. And so that's at course.prolohealing.com/quiz. So they can go to that, and that will give them a better sense of what to do, and whether or not they should have a conversation with their doctor, or there's the courses available too as well, which certainly can provide a lot of helpful information so that you can really start looking at things in more detail. And there was also a book I put out a long time ago. And I gotta have a resource for my patients. I put it out during the pandemic because we had a lot of time to do things back then, but it's called Getting to Pain Free: How to Make Your Body Stop Hurting So You Can Start Living Again Without Drugs or Surgery. And so what it does is it kind of chronicles kind of what I went through. It also chronicles what some patients have gone through and their outcomes too as well, and goes over things that involve diet and exercise and mindset and all of that. And so I kind of use it as a resource for people to say, hey, look, there's an alternative to what's being done out there. You just have to open your eyes and your mind a little bit to it.
That's great. And I assume this book you can buy on your website or on Amazon.
Yeah, it's on Amazon. It's been on Amazon for a while. So it's definitely out there as a resource for people.
Right. All right. Hey, well, Doc, thanks so much for your time today. It was great chatting with you, and good luck to you in helping more people be healthier and happier and have better longevity with less surgeries.
Yeah, appreciate that. And Grant, it was great to be on the show today.
Appreciate it. Talk to you again soon.
All right. Thanks so much.
Bye. Thank you for tuning in to the Fountain of Vitality podcast. Head to fountainofvitality.com for more episodes, insights, and resources. Remember, your health is yours to own. Take charge, focus on what you can control, and keep exploring what works for you. Always be your best self, lift others, and trust the compass of wisdom. Until next time, stay vibrant and take care.